Welcome to the Mount Pilgrim Missionary Baptist Church Network, where we are building faith and transforming lives, where our senior pastor is the Reverend James I. Perkins.
Well, good evening, and welcome to Mount Pilgrim Straight Talk. We are honored and blessed this evening to have the honored guest with us this evening, Dr. Diane McCliton, who is the Chief of Emergency Management for Caldwell County, and also serves as physician in our UNC Emergency Department. So I know that's a blessing. That's a plus in the Emergency Department. So Dr. McClinton is so glad to have you with us this evening.
Thank you very much, Reverend Perkins. Just a little clarification. I am the chairman of the Department of Emergency Medicine at UNC Caldwell.
Okay.
And I'm the medical director for the emergency services.
Okay.
But I would never want the job of Chief of Emergency Management for Caldwell County. I am not qualified for that. There are very qualified people doing that, but I am definitely part of the system. Okay. And wear a couple of hats in the county currently.
Very good. Well, I tried my best to escalate you, to put you up there. But, you know, with your humility, I can understand that.
Not quite there yet. Thank you.
We're going to, just to, as I said, get into some straight talk. Okay. One of the things that has been circling questions in the community, particularly in the church here, is the vaccine protection. As I shared earlier, there are people that may have had a vaccine and maybe had two vaccines, but it seems like that one or two people have contracted the disease, the coronavirus, having the two shots. What kind of protection, doctor, or what can they do, or what's going on there?
Okay, and that's a very good question. I know a lot of people have the same question. So from what we know of the vaccines so far, they are very, very highly effective, especially the mRNA vaccines, Pfizer and Moderna, but also the Johnson & Johnson vaccine. And in people who are otherwise healthy, not immune compromised, meaning not on immune suppressive medications that would match their response to a vaccine. Yes. The vaccine is over 90%, if not 95 or greater percent effective. Yes. If you are fully vaccinated, so 2 shots of the mRNA vaccine or 1 of the Johnson & Johnson. That being said, there's that 3-4% or up to 5% of people who just don't respond. And there's no way to predict who's going to. Every vaccine is like that. Every vaccine you take, your measles vaccine, your tetanus vaccine, your flu vaccine, of course we know, is much less effective. Right. So there is no such thing as a 100% effective vaccine. So you're always going to have breakthrough cases, sporadic, and there's no way to predict. However, what we have discovered is that the people who are fully vaccinated and who subsequently contract the COVID-19 virus, they have a much less severe case than someone who is unvaccinated. And very, very few, if any, end up having to be hospitalized or die. So it's definitely, even though there's not 100%, it is still definitely your best protection against the disease.
And I don't know if we've even asked this question, but a person that is on some real high medication or some high doses of medication, would that affect the protection of the vaccine in that individual?
It depends what the medication is. So medications like your blood pressure medicines, your diabetes medications, no. If you are on strong cancer medications or immune suppressing medications, people who have like rheumatoid arthritis or lupus, people who have those diseases that need to have their immune suppressed, people who have had transplants, organ transplants who are on immune suppressive, then they probably don't make as robust of an immune response as someone who's not on those medications. That doesn't mean that they shouldn't get them. Those are ones that they should talk with their primary care doctor or their oncologist or their rheumatologist, whoever's prescribing those medicines, to see whether they are eligible for the vaccine. And if they are, they should definitely get it. They may have to take more precautions, though, afterwards, knowing that they wouldn't necessarily have the same protection as someone who's not on those medications.
Well, how much I guess, protection for youth, children? Does the vaccine share the same protection for a 12, 13, 14-year-old as it would a 50, 60, 70-year-old?
And from what we know so far, yes, and that's why the vaccine was just recently expanded to include children who are 12 and older.
Okay.
Because the studies have shown that the vaccine, first of all, is safe for them.
Yeah. Okay.
And second of all, they do respond, and it's effective in those children.
I guess the other question concerning the vaccine, maybe you may, but what is the population or the youth really getting the shots, or parents bringing their children in for shots?
Not as robustly as we would like.
Okay.
I think it will come, but it's definitely slower because people have been led to believe, and it's mostly true, that children don't tend to get as severe of a disease.
Right.
So people aren't as willing or as excited to go out and get their children vaccinated. However, what they need to also figure in is that those children can still get the disease, and even if it's a lower incidence and they're not very sick, they can still transmit it to others, like their grandparents or family members who do have immune problems. Yeah. So it's still important to get vaccinated.
And I'm glad that you said that, because the news, the media, gives us false information saying that, well, children can't be transmitters of this, but that's not true.
Not true at all.
Okay,
not true at all.
I'm glad that that is open now. With the vaccine and with wearing the mask, or should we still be wearing the mask even though we're so far into the protection of the vaccines, and a lot of people have just dropped their maybe guards or their requirements as to wear a mask? Doctor, should we still be wearing a mask as we were in April of last year, May, June, and all through the year last year?
I think that's part of that is an individual choice, but it also depends on your particular vulnerability.
Okay.
So in this spring, after most of our elderly became vaccinated, most of us who are healthcare providers, frontline providers who were eligible for the vaccine got vaccinated, and we saw our cases drop dramatically.
Yes.
Like we fell off a cliff, they're gone.
Yeah.
Very few people in the hospital. We weren't seeing them come into the emergency department, and we all felt pretty comfortable. Now, however, we're starting to see what you've heard in the news called the variants.
Yes.
And one particular variant, the Delta variant, which started in India, has spread around the world and is now probably the dominant strain of the virus in the United States. It is more easily transmitted than the original coronavirus. So we're starting to see cases tick up again. We're starting to see increased percent positive in North Carolina and in Caldwell County. We're starting to see a few increased cases come into the emergency department and be admitted. Not a huge amount right now, but it's just getting here. So we're trying to get ahead of it before it gets to that point. So knowing that that's out there, you need to take that into consideration. If you are vulnerable, if you are in a closed inpatient setting with people, or inside buildings, going to weddings, even your church congregation, you may consider using the mask again. I will tell you personally, I've gone back. I'm using it when I go into the stores now. And I admit that I felt pretty confident a month ago. Felt pretty good about it. I was willing. I'm running in for my food. I'm okay. I'm putting it on now. Because not that I feel that I'm at risk personally. I think I'm probably okay. I don't have anything that would make me more vulnerable. But I see very sick patients in the emergency department. I would hate to think that I transmitted that to someone else. I have family members who are more vulnerable. I don't want to transmit to them.
I think, and you can correct me, that you say that the variant was more easily to contract than the COVID.
Exactly.
Why is that?
So it's a mutation in the RNA, which is the genetic material that is inside this virus. It's the genetic material that makes all of the things that make the virus a virus. And that mutation has made the virus, let's say, more sticky it sticks to your cells easier, and it can get into your cells easier, and it can replicate inside easier. So what we're finding is that people who contract this variant are more infectious. They have more copies of the vaccine, of the virus itself.
Yeah.
So they're more infectious. So they may not, even if you're vaccinated and you get this, you may not have really severe symptoms yourself.
Right.
But you're making more virus that you can shed and then transmit to other people. So it's concerning, and that's what the CDC, the Centers for Disease Control, calls it a variant of concern.
Oh, okay. You know, we have a lot of manufacturers manufacturing masks and different materials and different ways to do it. Is there? And I know that the requirement is to cover your nose, but I see a lot of people that just cover their mouth. Are they transmitters or spreaders, or can that be easily spread through your nose?
Yes,
as well as?
It can.
So it's necessary. I mean, it's important. Without the nose and everything, well, there's no need in wearing the mask. Is that what I'm saying?
Right. What we know is that this virus is primarily transmitted through respiratory droplets, and that's the spray that comes out when you talk, when you sing, when you cough or sneeze.
Yeah.
All of those mucous membranes inside your nasal passage and your mouth can shed that virus, and that's where it comes out. And people may think, well, I can just cover my mouth, but what they're not thinking is that the back of your mouth, what's called the pharynx, very back of that, it's actually connected to the back of your nose. There's no separation, it's all connected. And
you getting all that medical terms on me now. I was doing pretty good.
Well, just think of it that way. When you go to the back of your neck, of your throat, all the way back, you could turn the corner and go up and come out your nose. It's all connected. There's no separation there. So covering your mouth and leaving your nose open, you're still exposing those same nasal passages, that same area inside your throat and lungs. So you gotta cover them both.
You know, I was feeling pretty comfortable prior to this. I felt like, gosh, I got it made now. I'm doing this. But the more, doctor, you talk, and I'm trying to comprehend all of these medical terms that you're using, and some of them I do know. But you know, with the mask here, and you telling me, yes, they could still be spreading that, and I'm looking at people, and the reason that I thought of that, I go to the Quest. I'm at the Quest on Monday, Wednesday, and Fridays. I get there about 6:45, and now I've started on the treadmill. I do about 2.5 miles on the treadmill, and about halfway through that, I'll just take my mask down and I'll close it. And sometimes I'll just take it out, but I got one of those that wraps around my neck, and I'll just drop it. But when someone comes up to me, then I'll put it back on. Am I safe in doing?
We think that as long as you are at least 6 feet away from someone, and it's a fairly open area like the gym, I can't tell you for sure, I can't give you numbers, but you're probably okay to be like that. But there's still a chance. I can't tell you that it's 0%, but it's much less likely.
You ruined my days at the Quest.
I'm sorry.
I'm sorry. I don't know if I'm going to go back.
And I understand. I know. How hard is it? It's hard enough just to wear a mask all day.
Yeah.
I mean, when you're not exercising, but to be exercising, it's very difficult.
I can about imagine a teacher where masks are required for the students, and trying to watch these robust 6, 7, 8-year-olds and making sure that they are keeping their mask on. And I can, you know, and now I guess the question is whether the masks are going to be required in school for the children. And I don't know if teachers get enough thanks for having to monitor these children, making sure that they keep their masks
Absolutely. On. It's an impossible task, and we owe them a great debt.
Absolutely.
Our teachers.
Yeah. The other thing, and I hadn't seen my sign yet, but I'm going to keep on talking. You keep, don't look that way, because this is getting interesting now. I was thinking about the variant, and I know there may be an additional, or there have been reported maybe an additional vaccine to maybe combat that or do something with that, or is there a third vaccine that I've already had 2.
Mm-hmm.
Now, will I need a 3rd vaccine?
The short answer is we don't know. We don't know
Okay.
yet. There's not enough information yet to know. So there are ongoing studies where scientists are following people who've been fully vaccinated, checking their levels of antibodies, their level of immunity over time to see what happens. So we don't know yet. I would not be surprised if we don't need some sort of a booster. We may not need it this year, but I think probably eventually. Most vaccines don't last forever.
Right.
When you think about it,
Yeah.
you need to get your tetanus every 10 years.
Yeah.
You need to get your pneumonia vaccine. You have to get that redone. So
Yeah.
most vaccines don't last forever, and varying levels of immunity start to wane off after time, and we'll learn that as we go on, and then they'll have recommendations for who needs to get vaccinated and when.
Yeah. You know, and I know, like you said, this is going to be a continuous thing each year or every 6 months or whatever. But it's going to be difficult, would you not think, with people now not wanting to take it now, but to say, well, hey, look, this is going to be maybe not a requirement, but this is going to be something you have to do on an annual basis.
Exactly.
Is to take one of these shots. So now we be taking 3 and 4 shots. We got to take the flu shot, we got to take the pneumonia shot, and then 10 years we got to take the technical shot. I don't know if I want. I'm getting terrified now. I'm getting scared now with all these needles and everything.
Well, I will tell you that for me it's the opposite.
Yeah.
Being in the medical field, I will take all the vaccines that are available.
Yeah.
I will be first in line to put my arm out. I'm terrified of the diseases because I see what they do to people. I don't want COVID, for instance.
Right.
My goodness, that virus gets into your brain. We know that it crosses the blood-brain barrier. It gets into the brain. One of the first symptoms people have is severe headache. They complain of headache. It's just unbelievable headache. They can't stand it. It affects their sense of smell and taste. Those are senses that are directly connected to the brain. So we know this virus gets into the brain. It causes inflammatory symptoms. It causes blood clots. It causes heart disease. This is a nasty player.
This is serious.
This is very serious. So don't be afraid of the vaccine. Be afraid of COVID.
Well, you've been in the ER. How do you just know, or what do you do with people coming in with all types of injuries and all types of sicknesses, and your staff has to, of course, administer some type of treatment to them? How are you protected, or do you ask, have you had your shots? Or if Ike Perkins comes to the ER, do I need to bring my card or my proof of vaccines, or whether I've had them or not?
No, you don't at this point. So we are still masking. All of us as healthcare workers are masking when we are in front of patients and going about our regular duties. So we are protecting ourselves, and we're protecting ourselves from you from ourselves. But we are also masking everyone who comes into the department. So when you, just like last year, when you come into the emergency department, if you don't already have a mask on, you'll be asked to put one on. So we're protected from each other. If you have symptoms that I think might be related to COVID, then I'll ask you, have you been vaccinated? Because it just helps me figure out who I think is more at risk. Or I'll ask you, have you already had COVID, so I know whether you've got some immunity. But there's no requirement to show any vaccine status when you come to the hospital.
I know this conversation could keep going on and on and on, and my time is running out, and I hope that at some point we can, I know we will, continue this conversation. I don't know where we can pick up. We'll just pick up somewhere and just continue on. And so thank you, Doctor, for taking time out of your busy schedule to be our guest this evening. And I'm saying, well, that's another story. I'll share that with you later on. But thank you so much for being here. And I'm hoping that everybody has tuned in, and I'm hoping that this will be a benefit and be a help for you, my audience, as you hear this, and maybe it will make you understand that this is a serious time in our lives, and not just a few people, but everybody needs to have this shot. So, Doctor, I would just want to call on you again for any closing remarks that you may want to share with us at this time.
I still encourage anyone who's not been vaccinated
to go to our vaccine clinic and get vaccinated. It's open Mondays and Fridays, and they do take walk-ins, and there's a number on the hospital website. Also, if you can call if you have questions. But if you think you have COVID or you have symptoms, you can still get tested as well. And if you are concerned and you're worried and you think you might be sick, you can come to our emergency department or call any of the clinics, and we'll help you.
Okay. Thank you so very much. And as always, when you're having fun and enjoying yourself, good times always come to an end. But this is not going to be the end of this conversation. So thank you for tuning in. And don't forget tonight at 7 o'clock, Mount Pilgrim, Lenore, NC, to share with us and to hear what Dr. McClinton has shared with us. And thank you so very much for tuning in.
Thank you for tuning in to another exciting segment of Straight Talk, where we get straight to the questions and answers that you would like to ask some of the leading people in Caldwell County. We look forward to bringing you podcasts that make an impact in our communities. So tune in every Thursday at 7 o'clock, where we will bring you Straight Talk. We want to keep you informed on activities that are going on within our communities. Be blessed. We will see you next week.